Bismillahirrahmanirrahim. I am Fatima Tahir, graduate of King Edward Medical University. I am lecturer at Department of Rehabilitation Sciences. Today we are going to discuss about hearing loss. We will discuss hearing loss, types of hearing loss, degree of hearing loss, causes, characteristics, and diagnostic tests of hearing loss. So basically, what is hearing? Hearing is the process that starts from the collection of the sound in the form of waves from the external environment, and it transfers the signals to the brain through passing through the three parts of the ear: an external ear canal, middle ear, and inner ear. So hearing can be measured in decibels. Basically, we will study here air conduction and bone conduction. These are the two pathways. Air conduction is the pathway of conduction that passes the sound, transmits the sound from the ear canal to the tympanic membrane that vibrates in the response. So bone conduction is the conduction of sound, and it travels from the mastoid process. It totally bypasses the external ear canal. Hearing loss. Hearing loss is a partial or total inability to hear. If it is a complete inability to hear, it may be called as deafness. It is also called as hearing impairment. So these are the degrees of hearing loss that starts from normal to mild, moderate, moderately severe to profound hearing loss. Above 90 decibel, it is called profound hearing loss, and these are the criteria that is assigned by the American Speech Language and Hearing Association. Types of hearing loss. Two types of hearing loss that are organic and non-organic. We will study organic hearing loss types. Those are three: conductive hearing loss, sensorineural hearing loss, and mixed hearing loss. Conductive hearing loss. So if there is any obstacle in the transmission of sound from the external ear or the middle ear till stapediovestibular joint, that problem that causes the loss will be conductive hearing loss, and it never exceeds from 60 decibels. The maximum hearing loss in conductive hearing loss will be 60 decibel, and it is reversible. It depends on the cause. Characteristics. There are two basic behavioral symptoms of conductive hearing loss, that is speech discrimination is good because the bone conduction is normal and only air conduction is involved in damaged. So bone conduction is normal, due to which speech discrimination is good, and individuals have softly spoken speech. Causes of conductive hearing loss. There are many causes of conductive hearing loss. Any foreign body, any obstacle in the external ear canal or tympanic membrane or middle ear fluid or the ossicles fixation, they may cause conductive hearing loss. Okay, causes of conductive hearing loss there are many causes: external ear obstruction, any impacted wax, foreign body, tympanic membrane perforation, middle ear fluid or tympanic membrane perforation, ossicular fixation. These are several causes that causes conductive hearing loss. Sensorineural hearing loss. And sensorineural hearing loss happens after inner ear damage, and there are two portions: sensory and neural. Cochlear hearing loss will be considered as sensory, and any damage to the vestibular cochlear 8th cranial nerve will cause neural hearing loss. So this is the permanent form of hearing loss, and it may exceed up to 60 decibels. It may exceed 60 decibels. Causes of sensorineural hearing loss: those are any damage to cochlea or any damage to 8th nerve and any tumor. These are all the causes of sensorineural hearing loss. There are known causes and unknown causes of sensorineural hearing losses. So the known causes are ototoxic drugs, any traumatic injury, noise-induced hearing loss. It depends. Noise-induced hearing loss happens when you are you have continuous exposure to the sound. Unknown causes of sensorineural hearing loss. Unknown causes may be any viral infection can cause sudden sensorineural hearing loss, sudden sensorineural hearing loss that may be unilateral, or presbycusis, that is age-related sensorineural hearing loss. Okay. Behavioral symptoms of sensorineural. In this, speech discrimination is poor because the neural vestibular cochlear nerve is damaged. It is involved. So in this, patient is unable to discriminate, and there is difficulty hearing in the presence of noise. patient talks in a loud voice because bone conduction is abnormal. When bone conduction is abnormal, the patient cannot hear his own voice. Mixed hearing loss. Okay, the hearing loss that involves conductive element and sensorineural element that involves all the three parts of the ear. It is mixed hearing loss, and it may be seen in cases of chronic suppurative otitis media, presbycusis, otosclerosis. Evaluation tests for hearing loss. So these are the tests that these are qualitative tests. These don't tell the quantity of the hearing loss. These are Rennie test, Weber test, Schwabeck test. These are basically tuning fork tests. Okay, so for knowing the quantity of hearing loss, we have diagnostic tests that consists of pure tone audiometry, play audiometry, ABR, ASSR, and autoacoustic emissions. These are the learning outcomes that students will learn from this topic. Thank you.